Well, hello, everybody. Welcome to the Clinic Experience webinar. We're excited to be joined today by Delina Hoffman and Jonathan Madera of Columbia Basin Health Association. They'll be our guest presenters today. My name is Alan Bucknam. I'm the CEO of Sync Times, and Sync Times is sponsoring and hosting the webinar today. So great to be with you. The purpose of this webinar series is to provide a forum for discussion about best practices and key findings that are improving the clinic experience for patients and staff, as well as staff safety and efficiency to help improve the patient experience. And so we've been doing this for a while, and this series has been virtual to date. We've had a lot of inquiries recently from our clients and from others about a best practices summit. And so we're excited to announce today that we're going to be having our first in-person summit related to this series, which will be held in Salt Lake City on October 20th and 21st of this year. We have registration open. You'll see a link that will be sent in the chat where you can find additional information about that summit. Whether you're a Sync Times partner or not, we hope you'll join us and your peers for this experience. Today, we've got a great audience from current clients of Sync Times as well as others. The content that Delina and Jonathan are sharing today, I think will be really informative, whether you're familiar with Sync Times or not, whether you're using it in your clinic and your practice or not. We invite everybody to say hi in the chat and to mention the city, state, health center that you're joining from, just to help give us an idea for who's represented today. And we're grateful again for you for joining us. So as I mentioned, we're grateful to have Jonathan and Delina with us and for them taking the time to share their clinic improvement experience. One of the questions that we get asked a lot is by health centers who say, hey, we can see that Sync Times would offer us a lot of data. And they ask then, so what are some examples of what your health centers are doing with that data to drive improvements? I think Delina and Jonathan, of the clinic managers and of the operations leaders that we work with, are two of the people best suited to answer that question. So I'm going to start, just give a quick bio for Delina and then for Jonathan, and then we'll pass the time off to them. Delina is the clinic manager for CBHA, or the Columbia Basin Health Association Connell Clinic. She began working at CBHA December of 2019 as a clinic manager. Her education includes a bachelor's degree from Eastern Washington University, a master's of education from Washington State University. And prior to working with CBHA, she worked in various positions within higher education as an adjunct professor, retention specialist, and director for the high school equivalency program, which is a federally funded program. Delina grew up in the Connell area, which is where the clinic that she manages is. She's passionate about her community. She's excited to bring her educational experience and expertise to CBHA and serve the community that she grew up in. She's bilingual in English and in Spanish, and in all of her work experience, both within and without healthcare, Delina has had a passion for working with underserved populations within the communities that she's resided in. I've had the chance to get to know Delina for about the last 2-3 years now, and it's always a pleasure. Delina is just a happy, smiling face who's always a pleasure to work with, and she's also one of the best clinic managers that I work with. She does a great job balancing the administrative side of her role with the leadership and the coaching side of her role for her care teams. Jonathan is the vice president of operations at CBHA. He started working at CBHA in June 2011 as a purchasing clerk. He then became the first management trainee and was promoted to become a clinic manager at the Connell site, where Delina works now. As a remote clinic manager, Jonathan focused on growing the business, building a high-performing team, and improving the patient experience. His success in these areas helped him become the 2017 Supervisor of the Year at CBHA. Jonathan has a bachelor's in business administration with a concentration in management and international business from Monterey College in North Carolina. He also completed his MBA in healthcare management from Western Governors University. Jonathan worked as director of operations from 2020 through now, through 2022, and he's promoted to VP of operations. He's bilingual in English and Spanish. He enjoys working for CBHA, the opportunity he's given to make a difference for patients, providers, and staff. I always like to tease Jonathan. Jonathan's a New York Mets fan, which, and historically has not been a good thing. Although in recent memory, it seems that, maybe things are looking up for the New York Mets. I'm personally a Seattle Mariners fan, and things have not looked good recently, and I don't think they're going to look good anytime soon either. But with that, we're excited to hear from Jonathan and Delina. So the time's yours. And as anybody has questions, feel free to post those in the chat. We're going to have this be kind of a discussion. And so as you have questions, throw them in the chat. We're happy to address those as we go.
All right. Thank you, Alan. Appreciate that. Easy on my Mets. We're having a good season. So we're hoping to keep that in the second half. So it's looking good. It's a good year for us. We don't care about the past, all right? Only about the future right now. So, all right, guys. So we're happy to be here. This is our second round on this presentation. So we had an opportunity to present to a group of FQACs about a month, maybe a couple months ago. And we are happy to share this again and give it a second run. So the title of our presentation was Best Practices in RTLS. And, it's typically just about 35, 40-minute presentation. So we won't take a ton of your time, but we wanted to share our experience with bringing Sync Times on board and how that has helped our staff and our patient experience. So the way we structure this presentation, I'm going to start by sharing the business needs. So why we decided that RTLS was the right system to implement now, what we felt it was the right choice. Delina is going to come in second and tell you about our experience, what impact this had in our staff, and the changes that were implemented in our clinics. And then I'm going to come back in towards the end of the presentation, and I'm going to cover a little bit of the analytics and the reporting. And then we have sometimes to answer some questions after that. But just like Alan said, we can make this a little more informal. If you have any questions throughout the presentation, just feel free to interrupt, send those through, make sure you don't forget about those, right? A couple of things I wanted to share before I start, just for comparison purposes. I want to share a little bit about CBHA. So we're a FQAC, we're located in Central Washington. We have 3 main locations. And for sightseeing purposes, we see about 37,000 unique patients, right around that. And about 180,000 encounters or visits for the year. So just for comparison purposes, our medical department is composed of about 30 medical providers, and dental, we have 12 dentists and about 8 hygienists. And our eye care department is composed of 3 optometrists. So just so you get an idea in comparison from your own organization. And also important to notice that this presentation was tailored to the implementation in our dental clinic in the remote site where Delina works, the clinic that she operates. So you're going to see a lot of examples. You're going to hear us talk about our workflows in dental. Now we do have we're sharing some of our experiences with medical as well, but for the most part, this was us sharing our success story in implementing RTLS in dental. Okay. So let's start with going over the business need and why we felt RTLS was the right solution for us. So the first thing we did, is when you're trying to understand your own operations in dental, we spent time really observing the flow. And we were seeing patients, we were being productive, we still, making a profit. So it wasn't that, we necessarily had an issue driven by that, but we always know that we have opportunities to improve. And when we look at the process, we look at what people were doing. We observe the operations within our clinics. We start asking questions to our staff. As a matter of fact, I do have a video in this presentation. This was some live recording that we did of Delina's dental clinic, or what it used to be before RTLS, before Sync Time. So I want to show that to you, right? So we installed some cameras, and this is what we saw, all right? So this was Delina's dental clinic, right? So what do you see here? There's a lot of moving pieces. So there's people moving around. Now they're not crashing with each other, right? They're not hitting each other. They're not bumping. They go in places, and it just looks chaotic, right? It looks busy. people have places to be, people to meet, right? Like people say. So this is what we saw, right? And we knew we had an opportunity to help our staff and use technology, leverage technology to help them communicate and help to get places. To give you some specific examples of what we found, we start, just observing what happens in the flow. We see a dental assistant, right, often walking a patient from the waiting area to their operatory, for example, and that's pretty normal, right? Or you see a dental assistant walking a patient to X-ray and moving it and whatnot. But then we start noticing, the dental assistants are out there looking for a coordinator. I'm trying to find my supervisor. Or we might, we ask the DA, where you heading, and she says, I'm on my way to sterile to find a second set of instruments because my provider just happened to drop an instrument doing a procedure. So now they're running out there to communicate they need that. Or how about this one? We hear from our staff, I'm looking for my dentist, where is it? Have you seen him? I'm sure that only happens at CBHA, right? They're looking for their provider, they don't know where to find them. And they're out there running their hallways. So sure it only happens to us, right? So things like that, right? We noticed for the most part that people were delivering messages. They were delivering communication on foot. They're walking across their clinics to communicate things, and we thought, there's better ways to do this. So part of the reasons why we decided that it was necessary to have some sort of a technology that would help bridge that gap with our observations of the process. Another factor and the reason why we brought think times and RTLS was because we had experience with that technology before. So back in 2017, we bought up with a different vendor. And back in the days, it was named Versus, and it was later bought by Midmark. And we brought them on early on for our main site, medical, dental, and eye care. So we have some experience. We knew what was good about RTLS. We knew what we liked about it. And we also knew the challenges we had with it. We knew the things that we didn't quite like so much. So we had some experience and with RTLS before. So that was also part of why we decided to bring Sync Times to our remote site in Connell. And then there's the topic of reporting, right? And we were using our reporting, our reportings were what you call human dependent, right? And what I mean by that is that we were depending on a staff member, clicking a button or changing the status of a patient accurately on time in order for us to gather information in the back end. So we were depending on people to move things for us to get reporting. So it was inconsistent, as you were imagining. Every time you depend on human beings to make something, you're going to have some inconsistencies in there. And we have, like I said, we've seen reporting for RTLS, real-time locating systems, and we knew the accuracy of that data was a lot more valuable to us. So in a nutshell, those were the reasons why, we thought, it's time to bring RTLS to our remote site. So we went with Sync Times. We got a great relationship with Alan and his team. And this slide here, I took this straight from their website because I think he does a great job really illustrating what we wanted to accomplish in this particular clinic. So, it starts with locating people. And what's the importance really of allowing your staff to know where others are at. So think about the examples I share, right? A DA looking for their coordinator or supervisor and spending time out there in the hallways looking for them. Finding your own provider, where are they, right? Do I walk across the clinic to go to the provider office and find that he's not there? He happens to be in a different operatory, right? So the time that he takes to do that, we call it wasted motion, right? In operations, or things that we wanted to eliminate from our clinics. Another piece that we find very important, like finding out who's not busy at the time. So imagine the value to an administrator who perhaps is handling a walk-in, right? If the patient just walked in and I'm trying to find out who's not busy at the moment that I can call upon to room this patient or to help this patient. And having the technology, on your fingertips, that I can tell, all right, I know who's not busy right now, and I know exactly where they're at, so I can go get them and say, I have a walk-in for you. Can you room in this specific room that I know is not busy at the moment? So information like that that can help us be more efficient. That was what we were after. And then it comes the topic of communication, like I shared, just for right now, that people were communicating, they were walking across hallways, they're walking across the entire building to communicate things. And those have been replaced with just the touch of a button, right? Notifications, reminders, things that pop in providers' screens, right? When the patient is ready and the provider can get a reminder in their screen, and they automatically know, I have a patient in room 5 that is ready for me, and then I have a patient in room 6 that is here for a checkup, for example. And they can, they have now information available to them, and they can better manage their time. So those are the things that our staff have just become accustomed to with Sync Times. And I don't think we can actually pull this back anymore. If we were to pull this back from them, we would have a big issue with our staff, because they just become embedded into what they do in a daily basis. And then there's Illuminate, right? This is about reporting. It's about having good data, useful data that add value to your administrators and the people that are making decisions, daily decisions in their operations. So I'm going to share some of those examples later on. But right now, I want to give Delina the opportunity to walk you through what a roadshow implementation was.
All right. Hi, everyone. So our roadshow implementation was actually pretty smooth. Sync Times and Dental was implemented April 19th, a bit over a year ago, and implemented in medical just this past September. We had Alan, actually, thank you, Alan. He joined us throughout the entire process, so that was really nice to have. From day one, we focused on the deliverables, which was to streamline workflows and improve the patient experience. Another focus was to have the providers and lead champions. This was crucial because we wanted to make sure that we're involving all people that would be actually using the system in this process. So making sure that we could get that feedback for them, not just for the workflows, but even the icons. So that made it nice. They were literally there selecting icons in certain meetings. And I know it might sound like something simple, but it's something that they were actually going to be using daily. So having their input on these tiny things that they would be using every day, it was important, not just to us, but to them. So they started making sure that we're getting that buy-in, not just from the ones that were those champions, but even from the other providers that were, rumors go around as to, well, what are you guys doing? And what are we starting to implement? So having those provider champions and lead champions really helped everyone else that would be getting involved start getting familiar with this new implementation. So it wasn't going to be something new that you just throw at them. Hey, we're starting this, and this is what we're going to do. Little by little, people started getting, hearing about it, seeing Alan and his team show up, and just the other providers and individuals hearing about it. So, so having that buy-in was important, especially during the COVID time. We all know that with COVID, there was so many things happening. So that was one of our worries. How are we going to implement something new in our new medical side or even in dental and during this COVID time? So I honestly think that was a great time to do it. And I felt that Sync Times, they came in with a plan. So making sure that from that first meeting, stating this implementation is going to be used as a tool. This isn't just something that we're just going to throw at you. This is actually going to benefit you. It's going to benefit the patient for their patient experience, but also it's going to be a tool that's going to help with your communication, especially when, during COVID, we had to use extra PPE. So helping providers not have to step out of the room with that PPE, then switch back on, having those tools at the touch of, just the screen from inside a room became very important. And I could see even during the meetings, providers noticing like, wow, this is really going to help us out. So having that was really important. With that being said, sorry, technical difficulties. Oh, there we go. With that being said, we know that implementing something new will impact staff, right? So let me tell you how these changes did impact staff. It wasn't in a huge drastic way. Like I said, little by little, discussing the changes and letting people become familiar really helped staff. So the first change was the beacons. As soon as people hear beacons, they're like, oh, are you going to be tracking me now? Is this to track me? It's, so making sure that it was clear, this is not to track you, okay? This is to make sure that we're showing patients, hey, if we're going to be here. It's going to show that you're going to, kind of lost my train of thought for a bit. Making sure that we explain you're not being tracked. This is to make sure that your alone time is being shown, and especially during COVID time, making sure our providers weren't spending too much time with those, patients that were possibly later on coming back with, hey, I tested positive, so like that we can help with compliance issues. So that was one of those issues. And then making sure that for safety purposes, they knew that wearing these beacons was going to help us out. If there's an emergency, we knew which provider to go to. If we had that walk-in, like Jonathan said, making sure that, we're able to locate that individual that can help our teams out. So making sure that we knew proper use, wear it on the outside, explaining those things. Those were little things that, in the beginning, we did get a little bit of pushback, but in the end, they realized that it is important to have this. The second change was the hand washing. So with hand washing, this really helps us in matters of compliance. So there's a sensor on those hand sanitizers that as soon as an individual puts their hand under there, the beacon actually tracks which individual used that hand sanitizer. And John will actually explain more about our compliance and reporting on that. So that was one of the changes. And finally, the tablets. These tablets, we explained, this is your communication system. You will not have to leave the room to signal, a DA if you need someone, or an MA, or if you need radiology. Everything can be done from the inside of the room. And again, during COVID time, it was important because they did not have to be switching in and out of their PPE to get this assistance, and then using up more PPE, especially because we knew supplies were limited during that time. So that really came in handy during those times. And then just making sure, especially for that code blue, when we've had emergencies, everybody knows, that code blue tab will signal all across the clinic showing there is someone in this specific area that needs immediate attention. So this has really helped also with compliance issues and making sure that we're helping the patient out as soon as possible. These were those icons that I was talking about that our teams actually selected. They are individualized to our specific clinics and lines of services. So these have actually changed quite a bit. We've met with Alan and his team a few times, and reports have been ran, and we decided, okay, you know what, this icon has not really been used. Do we really need it, or should we add something else? Like I said, during the COVID time, we added the swab is needed. So like that, someone from the inside can signal a patient needs to be swabbed, and someone automatically went to that room directly. And again, then different suggestions like, oh, you know what, we need extra anesthesia in the dental part. Can we add an icon for that? So we were able to adjust these icons based on the needs that we have at the moment, or if things change, we always know that we can get a hold of someone and they can add those or remove them and so on. So these are just some examples of that. And another change that they also had to get used to and learn about was the lights on the tablets. So these lights, they do have a purpose. This is our communication system. The purple will signal, hey, there's a provider in the room. If we're looking across the hall, we'll know where the provider's at, not just by the little icon showing that his image is there, but even just that color. Visually, you can look down the hallway and know exactly where a provider's at. For a provider, the second color, which is the blue, has been so helpful. Instead of them running around, who's my next patient? Where's my next patient? Because like Jonathan explained, that little chaos, yeah, it's valid. It did happen, So with this, they actually don't have to worry about that. Again, they'll look down the hallway, see that blinking tablet and be like, okay, that's my next patient. Oh, and my other patient's already checked in because I'll be that solid blue. So those little changes, I know some people might be like, it's just a color, but you know what? We were used to using flags on the outside of doors, like we have a patient here, or this room needs to be cleaned. So yeah, they worked again, but this has just made it so much better. So those are just some of those changes. And again, the red meaning, the room is dirty, and the green showing that the room can be used now. So with that, those are some of the changes. I'm gonna walk you through just our step-by-step patient experience. As soon as our patient walks in, that's when think time starts. Our patient gets checked in by our amazing front staff, receptionists, and as our two systems communicate. So think times and Athena practice communicate. So as soon as our PSR checks our patients in, they get added to that wait list and sync times monitors. These monitors, as you see in the image, that's actually our dictation area where our dental hygienists and dental coordinators, dental assistants sit. So that monitor is visually there. It's also in our sterilization room and providers' offices and on our desktop. I even have it on my cell phone. So if I want to see this, I can pull it up on my cell phone and I can see, oh, there's a patient waiting. This has, has been really helpful for me in the sense that I can see if there's been a patient waiting for a long time. You know, yes, our teams do get alerts, but I can even get that alert and just, you know, get a hold of someone. Hey, maybe go check on that patient that's in the waiting room, or give them an update of what's going on. You know, that really helps with patient satisfaction. You can even see that on our patient's face, like, oh, wow, you are paying attention to, you know, what's going on with me. So it's just a little thing that has been helpful. Once that happens, as you can see, they get added. This is kind of what I open my desktop to every day. This is my clinic. You see Connell Dental and Connell Medical on there. You can see the visits that are finished, cycle times. You can visually see, okay, who do I have in sterilization, if I need a provider, which rooms need to be cleaned. As you can see, even right there where it says exam 3, you can see that that MA is actually there. There we go. The MA is actually there probably to do those labs. There were signals, labs need to be drawn. And then there's other issues like, oh, this patient has been waiting 50 minutes. Let's go ahead and check on them. So that's just kind of what I pull up every day. So once the patient comes in, gets checked in, it's showing up on our waiting. This is the room that's showing, hey, I can use this room. It's available, green, ready to go. That's our provider there. That's Dr. Miron. So those are the images are shown for each room and which providers are assigned to that room. Our DA will bring the patient back, add them to the room. Once the patient is added, as you see, the tablet turns into that yellow color. It shows appointment time and the appointment type. And as you can see, this is also another option that we chose and our providers chose, that this is what they wanted to show on those monitors. I'm sure, you know, Alan said this before that that can be changed as well, but this is just what our team decided that would be the most beneficial for their workflow. As soon as the provider comes in, as you can see, it turns into that color purple. The other image, you can see, oh, the CA requested instruments. So that's actually what's shown on the monitor on the outside and all around the other monitors that are visual for other DAs to see in sterilization. So if there was a DA in sterilization, they can visually see, oh, somebody needs instruments. I'm already done. I can go in the system. And like that DA never had to leave the patient's side, and they got what they needed. And then this is actually the monitor that's in the inside of the dental room. So as you can see, all the little icons are there. It shows who's in the room. It shows which providers are assigned. And again, nobody had to leave the room to get these things done. And then finally, once the DA is getting ready to check that patient out, it's showing the DAs in the room, the patient's in the room still. It's that yellow color. And patient gets checked out. Once the patient gets checked out, it turns into that red color showing this room is dirty, needs to be cleaned. And then we come full circle once that room has been cleaned and it's showing that it's ready for that next patient. So as you see, it has this whole system. Of course, there's other things in between when people ask for, you know, extra anesthesia and so on, but that's pretty much the workflow. And it really helps with the time alone for the patient. You know, and the efficiency of making sure that as soon as something is needed, nobody has to be running out of the room, you know, trying to find the instruments. Instead, they're just there with the patient, continuing cleaning or whatnot, and somebody walks in, providing what they need at that moment. So as we know, obviously that was quite a bit of things that, you know, as somebody would have to learn, and our employees did have to learn. But luckily, Think Times has provided us with a new employee training checklist. This checklist really has become part of that workflow for when we have traveling providers, traveling teams, and it helps me even as a guide when I'm showing them, hey, this is how you do, this is how you check patients in, these are the colors, these are the icons that we use. It's just a nice visual that individuals can have, and they could even sign up for a training that also gets where they get an email saying, hey, you know what, we have this available for you if you want to learn more about it. So that also makes it nice. And in the end, it optimizes the patient workflow, and that's what we want. Patient satisfaction, streamlining those workflows, and that's what we received during this time. So thank you.
Real quick,
Jonathan,
Delina, I'd love to just ask Delina a question. Sorry, Delina, you're not getting off the spot just yet. So thanks for sharing there. I'd just love to hear, Jonathan showed, the live video reporting, right, of the health center. I think there's one of the things that we've observed that's kind of interesting is when you're in that intersection as a provider or as a medical or dental assistant, sometimes you don't really realize, like, oh yeah, there is some chaos going on here. And so I'd love to hear, Delina, just a little bit about, from the ground, what was the, I guess, evolution of kind of staff, their view of this? I think a lot of times initially we see people and they say, no, our patients don't wait at all. They say, well, no, we actually are really organized here. And then, as we go in and we show them, start, implementing some of these tools, they realize, oh, wow, this is actually something that has helped us to structure our workflow better. So I'd love to just hear, your experience with that, Delina, going from, that initial chaos, and then how would you assess that today? Is it a traffic light now, a roundabout, and then also just, what's the staff feedback been throughout? What's that evolution looked like?
Like we said, things did work. Everything worked. People were running around with little papers and those flags, and hey, where's my new patient? Or crashing, maybe, sometimes. But, really, it has changed. It almost seems a little empty in the hallways just because everyone is just so focused on the light. They already know where to go. They're not trying to run around trying to figure out, where do I go next? They look up at that screen, they look at their monitor, or even their cell phone, because, I even have, in the medical side, I have my radiologist, she actually has it on her cell phone because she also draws blood. So she'll get alerts on her cell phone, being like, oh, I have an x-ray right after this. She knows which room, she knows which provider she has to go to if she has any questions. So it's just that streamline, and it just makes things flow by so much faster. And the input has been really good. I was surprised. Just with everything new, but it has really made a difference. And like Jonathan said, I don't think we can pull it back just because of how helpful it's been for individuals not have to leave that patient to go and run and get an instrument, try to go find an extra DA when they need assistance. Even for emergency purposes, trying to run around, find, hey, where's the red card? Where's an RN? We just put that code blue and somebody knows where to go exactly. Nobody's trying to figure out which room where this emergency is happening. Everybody knows, I'm going there to this room. This is who's in there. This is who can assist me. I know if I need an extra DA or MA, this is where they're at. So yeah, it has been great. So I don't know if I haven't answered your question, but
yeah, it sounds like maybe in a lot of ways the intersection's empty because everybody's already where they need to be a little bit. It's kind of it's pretty cool.
It's a little
I like there's a story that I share with others sometimes that came from the Connell Clinic when we first went live. And Delina, you'll remember this fondly. We had one provider on the medical side whose feedback was, hey, I'm good at my job. I'm efficient. I really don't see this as benefiting me. Can I just opt out? Could I just say no? And the feedback was, well, no, we want to know that, we want to know what you're doing right so we can share with others. And also, we think this is really going to help you. And the feedback was kind of, yeah, right, sure, I've heard that before, and to her credit, I think historically, the relationship between software and healthcare providers has not been a positive one, right? But anyways, we kind of fast forward about 6 months, and I came back into the clinic just kind of spontaneously. I was in the neighborhood visiting another FQHC, and I dropped by, and as I walked into the nurse's station, that provider said, "Hey, Alan, I love sync times. I love the ability that I have to communicate. I just wanted you to know that." Which was really nice for me because last time I talked to her, she didn't really seem like my fan. So I think that's just, those are fun stories.
I don't think it was.
Well, thanks,
Awesome.
guys. Go ahead, Jonathan.
All right. Moving on to the analytics, right, or the reporting. You know, I always say that this is the part that is like sugar or caffeine to the administrators, right? When we talk about reporting, I think a lot of us just crave data, we crave information, we want to know, you know, we want to slice it, we want to break it down, we want to drill down. And I think, you know, Think Times does a fantastic job putting it in a format that, you know, you can digest and dissect and break it down and really understand. So I'm a fan of this on Think Times, and I got some examples of what we're looking at right now. And this first one is more specific to our medical provider. So in this particular clinic, and let's see, hopefully you can see my mouse cursor right here, so I can direct your attention to the different quadrants. So I want to start here on the top left quadrant. So we have the ability to track the productivity on visits per provider hour. So that's what you see here, breaking down on a monthly basis, right? So from 2.2 patients per clinical hour, and that's kind of increasing right from when we started with Think Times and making sure everybody was getting tracked. And you have the opportunity to break that down and see it per different provider. On the right side, on the top, and then we're talking a little bit more about cycle times. And not just a total number of cycle times, but a breakdown of where the minutes are going, which is really more important to us, rather than seeing, you know, on this bottom one, you would look at Jennifer Kaiser, for example, running a cycle time of about 45, 50 minutes here compared to Justin Kane. But when you have the ability to break down where they're spending in time, you can look at things like how much is it provider time, specifically how much are they spending with their patients when they come in, or how about their teams, right? Those clinical teams, the MA, rooming the patient, completing the intake, completing the vitals, and what are they, you know, where are they spending their time. So I think it's really, when you get to real-time locating systems like Think Times, they have the ability to break it down into a little more specific areas rather than their old school way of just looking at cycle times as a total number. This is, to me, a lot more valuable because it allows me to put the finger right where where I need it. Allows me to identify the real issues just by looking at this, right? So I think that's the tremendous value to us. If I direct your attention to the top of the screen here, to us, this is, when we look at these trends right here at the top, is really what we want to see. You know, you want to see your productivity going up or staying, you know, high, and you want to see that time alone decreasing. So from the time we implemented Think Times, you can see there was a intentional effort to decrease time alone. So we start asking questions: why are people waiting in an exam room by themselves? You know, we also understand perception of time. So knowing that, you know, 5 to 10 minutes waiting in a waiting area where you have TVs, you have people walking by, windows, you know, it's not the same of waiting 5 to 10 minutes in an exam room, right? We got 4 walls and yourself in a room. So your perception of time wait is very different. So we have the breakdown here, you know, easy to see. So we can see how much people are waiting outside the waiting area and how much of that time alone in the room people are spending. And we want to be more intentional about decreasing that. And you can see, right, our performance through the first couple of months of using Think Times and how the time alone went from almost 14 minutes to about 10. This actually has continued to get better as we learn, you know, about our opportunities to improve. The next slide, and now switches to dental. And in this particular clinic, you know, we have 2 dentists. You can see their productivity on the left side here, productivity per provider. One of them is newer, so Dr. Jimenez here, as you can see, has the productivity numbers are a lot less than compared to Dr. Miron. He's a seasoned dentist, have been with us for many years and highly productive. So what is it does for us is that, you know, like I mentioned at the beginning, this type of reporting doesn't only give you the opportunity to see productivity in a clinic, but it allows you to get into individual performance KPIs and measures. So we are now developing our baseline, right? We're relatively new to this reporting, so we're starting to understand where does a 3-year dentist with 3 years of experience, where does their productivity should be at, right? So we have the opportunity to show to a new dentist and compare it to another one and say, this is where you should be, by the end of the year, or this is where we want you to be, and this is where you're at right now. So in this very specific example, you can see, when you compare side to side, the time that the patients are waiting outside, the time alone, pretty similar. If you look at what their dental assistants were taking, oh, sorry, I went ahead. What the dental assistants were taking, it's about 12 minutes to prep the patient. So if you were to only have a cycle time, the total, right? You only see maybe a 45 minutes versus a 35 minutes, and you wouldn't have no visibility into what happens here. And I don't know any other way that you can get to this data without a real-time locating system like SyncTimes, right? I don't know that you can talk about time alone without having, the technology to track live when people walk in and out of a room, when an MA goes in, when a phlebotomy goes in, when a provider goes in. I don't know that there's any other way to get there without this. So that's what I call innovative reporting in our end. There's KPIs that we have never used to talk about, and now they matter. Now we talk about them. And if we know that if we can measure those things, we can improve them, right? Because we start asking the right questions. So that's the kind of power and the ability that I like to provide to my administrators. So here's the data, go ask the questions. We do that, what we call a Gemba walk, right? We go to the floor, we spend time with people, trying to increase our understanding of the operations, right? So that was the case from Dr. Jimenez. And I want to show you, we have, in this case, the ability to break down specific to a provider. So this slide here shows only Dr. Jimenez numbers, right? So we can look at his productivity and where he's at, and we can look at his cycle times. And in this very specific case, when we noticed that he was spending about 22 minutes, okay? So compared to what Dr. Miron was doing, he's going through patients at an average of 9 to 10 minutes, and our new provider was doing 22 minutes, right? So Delina sat down with him. She took exactly this slide, right, this information here. She took this and met with him right around October. So you can see the trend line here. She met with him. She showed the numbers. She said, this is where you're at. And then show him a different dentist. This is what we would like you to be, and it's doable, right? Because somebody else, a lot of other people are doing them. I know what my average dentist now spends with the patients. I did not know that before, using RTLS. And you can see what happened after that conversation. So he cutting the time that he spent with patients by a full 10 minutes. So think about the efficiency, the opportunity to, he could almost feed another patient, right, in the same time that he was spending before. So when people ask the question about, ROI, how do you measure like return on investment on a tool like this? Well, I think this, this example here helps explain or answer that question. It's like when you give yourself the ability to, do things more efficiently, then you can increase access, right? When you have the opportunity to use data to back your point of view, right? Now that rather than you approaching this dentist and acting like you know it all and you should be seeing more patients because I know so. Right now I have data to show them like, look, you're spending twice the amount of times at a different dentist. We can cut that to here and we can see another checkup there, another recall. So we're able to operate in a more efficient manner when we have the data to support that. So that, those are being some of our success stories with reporting of what we've seen. And I have one more.
And I want to add to that, that has even helped with the DAs bringing back patients sooner, and even providers being more mindful of, their DAs or MAs, making sure that they're bringing those patients back. Yeah. And even our PSRs when they're checking the patients in. So it just kind of goes full circle. It kind of really helps everybody make an improvement overall, not just providers. So that has been helpful because you actually have the data to show your staff. Look, this is where we're at, but this is where we can be. Yeah. And let's try to, be more efficient in these areas. So
absolutely. And then if you think about, sometimes when we talk to a provider who might be struggling with cycle time, sometimes they say, well, it's my MA, or my DA, they're taking too long, right? Yeah. Well, now we have the data to prove like, well, they're consistent, right? Yeah. Maybe they're above average or, or what we would consider average time for other clinical teams, or supporting teams throughout our organization. So really the issues with the time that you're spending and what can we do to help you get to the point where we are a little more efficient with that. So that's a good point. Like I mentioned before, it's not only about the the productivity and the KPIs for your clinic, but this becomes a individual performance tracking as well. If you want to see it like that, you can use this data in that sense. And finally, I wanted to share, some of the opportunities for improvement we still have, right? So, not everything is perfect. So we still got some work to do. And this specific graph shows our performance on hand washings, right? So Delina showed you, we have those sensors installed in the dispensers, right? The sanitizer dispensers. But then we learned, that we still have staff and providers that, they're the old school. They rather use soap and water in a sink, so we can't really track them. And then we have other people that have different ways to go about how they sanitize their hands, outside of the room perhaps, so they use their hand sanitizer before they work. All these kinds of stuff that we still working it out. So it's part of what we're looking forward to do. We still see value in this, better than what we've been doing in the past, which is let me have somebody with a clipboard chasing you all day. And what happens when I'm chasing you with the clipboard? Where you wash your hands 100% of the time because I am actually watching you, right? So it's very different. So we see value in having an ability to track every single time somebody goes in there and wash their hands. This is obviously a compliance requirement for things like Joint Commission, right? So I'm sure people are familiar with that. So it's a work in progress, and I know Alan and his team are working hard to come up with a better solution for us and things that we can utilize in the future. So that's our presentation. I wanted to open up the room for questions. I don't know if anything on the chat, Alan, anything for us?
Yeah. Well, thank you. I think one of the things that I wanted to highlight that you guys have done a great job at. We talk a little bit with leadership teams about an idea that we call data altitude sickness. And what that means is that sometimes the data, lives at the administrative and operational level of the organization, and it never gets down to the care teams. And so we gather all this data at the care team level, we send it up the mountain, and then it dies of data altitude sickness up there. And I think what you guys have highlighted is that you've just done a really good job getting that data down to the care teams where we can actually do something about it. And I just commend you for that. That's awesome. I wanted to ask, so this is a question that we've had is, what is the team's feedback then to the data that is captured specifically through Sync Times? Meaning that, obviously we talked a little bit about adoption, but how have they reacted specifically to the data that you're capturing, and how have you presented that to involve the care teams?
Okay, honestly, they've really enjoyed it. Like I talked about Dr. Jimenez, he actually stops by my office every day. You know what, Delina, let's check my numbers. Let's see where I'm at now. So he kind of almost sees that as a little competition within himself to improve. And I even have MAs come back. Oh, did you see how many patients I checked in? I've been bringing in a lot of patients in, and so it's having those conversations with them when I do my rounding has really been helpful. So I pull up this data, be like, oh, look, you were able to bring this many patients back and still provide the quality service we want for our patients. So it has been looked at something good. Obviously, the hand sanitizer one, which we discussed, that one has been a little bit, more hesitant just because, well, I wash my hands with water and soap. I don't use, the hand sanitizer. So, just comments like that. But besides that, the other data that we pull up about cycle times and whatnot, it has really helped out. And I think they are noticing even their work. So DAs are like, oh, I need to make sure we're, as a team, bringing the patients back in as soon as we can, making sure they're not waiting and so on, because they start comparing each other too, in a healthy way, let's say. So it has been helpful in that sense.
Yeah, we have, my experience with talking to staff about showing this data. So we just went through a change, right? We were using medical schedule templates that were 15 and 30 minutes, and we wanted to move to a more of like 20 minutes all across. So only 20-minute appointment template. And we have embedded some double bullets in our schedule for all our medical providers. So, that was an increase in slots in there. So they went from seeing, 21 patients every 7 clinical hours to now there's 25 slots in those same 7 clinical hours. So how do you approach a conversation with providers about that is using this type of data, right? So we were able to explain, like, you average 7 minutes. That's your average time with your patient. And your staff is doing intakes in about another 7 to 8 minutes. So this is doable. And there's the data to prove that. We just need to get better at coordinating this visits. And I think this will overall help our own flow.
Yeah.
And it's doable. So that has been my experience, kind of, you know, finding value. They see it as well, right? It's hard to argue with data, which is what we've seen, right? It's easy to argue with my opinion, but it's hard to argue with data when it's something that I'm showing you what you are doing, right? I'm not making that up. This is the numbers of your own performance and what your routine is with patients.
That's great. Well, I think we're going to probably wrap it up here, but anything else, Jonathan, Delina, you'd like to add before we do so? I want to be respectful of your time and everybody who's on.
Just thank you, Alan. Honestly, throughout the time, you've been really helpful, you know, with our staff and answering our questions, which I think that's what made it pretty easy for it to get implemented.
Yeah. Absolutely. I think it, so far it's been a success for us. Our staff love it. Like I said, we can't pull it back now. They have become highly dependent on it. Yeah. And as an administrator, we love it as well. And what I like most about it is that it's really not just an administrative tool. This is a product that is designed for the folks on the floor. They see value in that, which makes my life easier because I don't have to sell it to them, right? They understand how these can make their life better. Yeah. So.
Good.
Excellent. Well, thank you so much. Thanks everybody for joining. Jonathan, Delina, always a pleasure, and just really grateful for you for sharing your perspective and some of the things you guys have done to make this such a success. So thank you.
Okay. Thank you.